Hello, I am Dr. Mona Wiggins, and I'm excited to talk to you about getting started using fertility awareness. So the first step is to choose a method. There is numerous different methods, so choose one that is going to be a good fit for you, your body, and your circumstance. I personally use and teach the Symptothermal method because it allows me to have numerous different biomarkers that I can use to confirm if I've ovulated or not, and if I'm fertile or not. So with the Symptothermal method, the biomarkers, or what we're looking at in our body to confirm when we're fertile and when we're not, is our basal body temperature and cervical fluid. You also have the option of tracking your cervix positioning, but that is not a requirement. So by tracking these biomarkers, we can know when we're fertile and when we're not, where we are in our cycles, when our next bleed is coming, and also understand the deeper energetics of our hormones and our bodies. So every cycle, our bodies go through these cyclical patterns. So we have 4 phases of our menstrual cycle that we're looking to identify and clue into. So the first phase is our menses, and that is the entire time that you're on your bleed. And then you can divide the cycle into other parts. So from the beginning of your bleed, so again, this includes your bleeding, until ovulation, you have your follicular phase. And then ovulation is that key event or the main part of your cycle. And then after ovulation until your next cycle is known as your luteal phase. When we're using the Symptothermal method to identify where we are, our temperatures are really easy to help with that. So our temperatures show us overall low patterns before ovulation and overall high patterns after ovulation. But it's really important that you're not just using temperatures to confirm ovulation, because this only tells you after the fact if you've ovulated. So if you're trying to avoid pregnancy, you could have missed that entire fertile window. So it's important to also track your cervical fluid. So our cervical fluid is unique for each of us, but it comes in a wave-like pattern, typically towards the end of menses or after menses. And then as our hormones rise, we start to notice an increase in the amount and sensation and quality of our fluids until they hit this kind of wave-like pattern of a peak, and then our cervical fluid drops back off. So we're looking for this shift in our cervical fluid and then a rise in our basal body temperatures to tell us that we've ovulated. Tempdrop, again, is such a super fabulous tool in this process because it really helps to make it overall easier. So if you haven't already, I invite you to check out their guide that is on getting started charting, and also Tempdrop Academy, where you can find more information and education for your cycle.